morning, everyone. My name is Richard Such, and I am a current Medical Society of Virginia board member and past president. Welcome to this morning's webinar about the latest on Virginia's COVID-19 vaccination approach, as Virginia pivots its strategy to reach those who are vaccine hesitant or less enthusiastic, along with efforts to ensure that Virginians return for their second dose. We're very pleased today to welcome Dr. Danny Avula, Vaccination Coordinator for the Commonwealth of Virginia and Director of the Richmond City and Henrico County Health Departments, Dr. Chris Gayamagamai, Professor of Emergency Medicine and Internal Medicine Senior Advisor to the EVP for Health Affairs at UVA, and Christy Gray, Division of Immunization Director at the Virginia Department of Health, as this morning's presenters. As is customary with all of our MSV webinars, I want to just make a few points at the beginning. Following the presentation today, we will have a short question and answer portion. I would like to remind everyone to please use the Q&A function at the bottom of the screen to ask your questions. If your question is not addressed or you have a question after the webinar is over, please email the MSV Government Affairs team at governmentaffairs@msv.org. And now, with the introductions out of the way, I'd like to hand the floor over to Dr. Danny Avula and his guests.
Thank you, Richard, and good morning, everybody. So great to be with you all here today. This has been an incredibly intense season of work from June to now. And I want to just start with a note of gratitude, because really, even before June, before the vaccination effort, all of you on the front lines, caring for patients, navigating this pandemic for the last year and a half, trying to support your own staff and your patients to try to figure out what's going on in this constantly changing environment around COVID has just been extraordinary work, reassuring work, life-saving work. And I really want to thank all of you on the front lines in this pandemic and now in this vaccination effort. And because of your efforts, we are in a really, really great place right now. And so I want to kind of give an update of where we are as a state with the vaccination effort, and then talk about what's happening in this next phase of vaccination and how you all as providers are really, really key to what happens from here. So I'm popping up my screen here. Hopefully everyone can see that now. All right, so as of yesterday's data, we're north of 4.8 million people with at least one dose, and 8.6 million total doses administered. And you see here that we're marching towards 50% of the population that is fully vaccinated. And the goal that you're probably hearing most about in the media right now is President Biden's goal to get to 70% of adult Americans with at least one dose by July 4th. And what you see here is that we are very, very close to that, 69.2%. Based on some of the numbers and kind of changing vaccination rates, I think we're probably 7 to 10 days from hitting that 70% mark. We need to average somewhere around 3,000, a little north of that, new adults a day getting vaccinated. But still, when you think about just where we've been over the last few months, it's pretty tremendous work. And so again, just want to thank you all. I know so many of you, not only on the patient care and patient reassurance side, but so many of you have also been active vaccinators, whether that's happening in your practice or through volunteer activity, as Richard and I were just talking about. But so many of you have found ways to be a part of this massive, massive undertaking, and we're so grateful. Here you'll see just where we are, the 70% benchmark line. As I said, just about 3,000 doses a day we need to get to our target. Over the last 7 days, we've been averaging around 6,000 a day. You'll see that here, 6,291 over the last 7 days. But that rate is dropping. And so we're going to need to keep pressing in, not only to hit the president's 70% goal, but because we know that isn't the end of this effort, right? We really need to continue our vaccination efforts to get to 70 to 80% of the entire population. And that means getting well north of 70% with our adult population. And then sometime in the fall, when vaccinations get approved for kids under 12, a whole nother round of this. But ultimately, the goal is to stop the transmission of COVID. And we don't know exactly what the magic number is to get there. Although, what we've seen so far has been remarkable. We've been averaging under 200 new cases of COVID a day across the Commonwealth. And for many of you, wherever you live, it was normal to have 200 cases a day in your own community. And so, yeah, we're clearly in a different stage of this. I want to kind of walk us along the timeline a bit here. Averaging about 28,000 doses a day. That largely is second doses right now. And just to kind of look back from our time starting in mid-December, early January, we saw this remarkable rise as supply became more available, as more and more vaccinators came to the table. We really hit our stride in the month of April, where we were averaging over 80,000 doses a day. You'll see multiple peaks here where we exceeded 100,000 doses in a single day. In May, we started to get to that initial saturation point. And so you saw the steady decline of average daily doses until about the middle of May. And two things happened here. One, the CDC really adapted the new guidance based on science, based on the science that showed that people who are fully vaccinated no longer needed to wear masks. And in most settings, outside of healthcare settings and congregational settings. And that was a big motivator. And so that led to a big uptick of vaccine here. And then in addition to that, that was right around the time where Pfizer's vaccine was approved for ages 12 to 15. And so that contributes part of what you're seeing here. But since then, we've reached another saturation point. We've seen this decrease. Over the last week or so, we've seen this little bit of an uptick that really correlates to Pfizer second doses for that 12 to 15 population. So that's what we're seeing right here. And as I said, we really do, this rate of decline to some degree is expected because the number of people yet to be vaccinated gets smaller and smaller, and you start to chip into that segment of the community who has just, dug their heels in and said, I'm not getting vaccinated. But then there is still a significant portion of our population that I wouldn't say is resistant, but have not gotten vaccinated for a number of complex reasons. And many of these you all are undoubtedly hearing in your own practices. In some cases, it really is just the value proposition. We're seeing a lot of young people who have not chosen to get vaccinated, not because they're against it necessarily, but just because they're like, well, if I get COVID, I'll probably be fine. Do I need to make this a priority? And so we, as public health, have certainly continued to convey the importance of not just protecting yourself, but really protecting your family and your community and stopping community transmission. So, all of this, kind of watching this trend line, over the last month, we've really moved into a different phase of this effort. And so we've gone from the season of vaccination where it was all about efficiency and equity, right? Getting doses out as quickly as possible to as many people as possible, doing that through mass vaccination events, but simultaneously ensuring that the segments of our community who are at higher risk were being prioritized. And so trying to do those things both well has been difficult, but I think by and large, we did a really good job as a state. But what has happened over the last month is that we've transitioned away from these mass vaccination events, and we're shifting to more and more mobile units, community events, pop-up vaccination, really trying to get where there's a lot of foot traffic or where there are communities who haven't necessarily had ready access, either because of transportation barriers or not having a primary care provider or any other number of reasons, and really trying to decrease barriers to access and increase convenience through mobile and pop-up events. Another hallmark of these past few weeks has been a huge shift to healthcare providers. And that's why we're here today to really think through and kind of redouble our efforts. So for the provider community, as we look at this segment of the population who has not yet been vaccinated, there is, you guys play an extremely important role right now to be able to talk to your patients, to reassure them, to answer their questions, but also to encourage them to do this, because so many people really do need to hear from you all if they're going to consider vaccination. A couple of different surveys. The Kaiser Family Foundation Vaccine Monitor has been a really helpful source of national information. And one of the KFF surveys showed that 73% of unvaccinated adults trust their doctor's opinion. Should be no surprise to you all. We actually thought that number might be higher. But only 19% of unvaccinated adults have actually heard from their doctors about the need to get vaccinated. And so I think this identifies an opportunity for proactive communication from providers to patients. And we'll talk a little bit more about how that can happen. Also, as we look at this, shrinking segment of unvaccinated adults, those who say they're hesitant say that 30% of them would be likelier to get the vaccine if it were offered to them during a routine medical visit. And so one of the take homes from this, I hope, is that in every interaction that you all have with your patients, that there is an opportunity to ask them and to keep this in front of them, and to continue to help them understand that we're not out of the woods yet, that it's still extraordinarily important that they get vaccinated. So I'm going to boil this down to kind of 3 significant asks of the physician community. The first is to ask your patients if they've been vaccinated. We'll talk a little more about that. Second, to actually become a vaccinating provider, because it is not only important and powerful for you all to ask your patients to get vaccinated, but also to be able to follow that up with a vaccine in the office. And then lastly, to consider the ways that you all can use your voice as physicians. You all have a platform, whether it's certainly with your patients, but really more broadly. So whether it is with a faith community, or a neighborhood group, or with elected officials, or with the media, I think there are really, really important roles that you all can play as credible, trusted ambassadors. And that is needed more than ever, given the amount of real misinformation that's out there. Let me pause and see, Chris, do you have anything for that we've covered in sort of that initial section that you want to add to or bring color to?
Yeah, I think, as you said, Danny, I think there's been a huge amount of effort, and there's been a great deal of participation by our physician community already. And particularly now, as you said, with the ramping down of the mass vaccination sites, we're looking at, how to use those relationships. And hopefully we can support you. And we're going to talk about that in a couple more slides, I think, about supporting you in that communication effort. So VDH and CDC have developed a lot of information that can be used to communicate with the patients and try and give them honest information so that we can try and pick up that next group of hesitant folks. I think, as Danny said, we're coming up on that 70% of all adults in Virginia, but there's a huge geographic variation that we're seeing. And so in some areas, it's far less than 70% that have gotten it. So we still think there's a lot of opportunity out there. And we can talk about sort of methods here in the next few slides.
Great. Okay, so let's just talk a little bit about the actual ask of your patients. How do you keep this in front of them? What techniques, what methods do you use? You all may remember, particularly primary care, may remember the push from 20-ish years ago to make smoking one of the vital signs, where we'd ask every patient about their smoking status. And so similarly, could COVID vaccination be considered in the same vein, to ask early and often, ensure that every patient interaction you have, that is flagged on the record? I've heard from some providers, best practices around the country, that they've set up their EMR to flag patients who have not been COVID vaccinated. This also does mean a significant degree of engagement and training and motivation for your staff, because your frontline staff will often be the ones assessing and asking these questions. Also, the importance of validating concerns, right? There are a lot of pretty crazy things out there on the internet, but people, for lots of different reasons, have held on to them because either they confirm a bias that they already carried, or they sound plausible, or whatever. But I think it's important for us to always validate their concerns and make sure that we're equipped with the information to effectively answer their questions. It's really important to just keep everything grounded both in positivity, but also in the evidence and science-based messaging, and to talk about the difference that vaccination has made, right? What we've seen, just in Virginia with the decrease in COVID rates, the precipitous decline in COVID-related deaths in Virginia and throughout the country, the remarkable success of an extremely safe and an extremely effective vaccine. I mean, all of these things are things that really should be held up and praised. And so helping patients see that and kind of get out of some of the negative framing that we and certainly the media are prone to fall into. And then also to acknowledge that this is a deeply personal decision, right? So for all of these individuals, they've got histories, they've got contexts, and there's a lot playing into this. All of COVID, vaccination is one part, but mask wearing, the disease itself have just been the subject of so many conspiracy theories and so much politicization, and so this has become a very emotional decision. And that I've talked to some providers and some pastors as well. I've started doing focus groups as we engage different segments of the community, and their unwillingness to kind of bring this up in different settings because of how emotionally charged an issue it is, that's real. And so recognizing and approaching in a non-judgmental way, affirming people's the need for people to make that personal decision, but always shepherding them to credible information.
Yeah, and Danny, that's a really important point. There are different segments of the folks who haven't been vaccinated yet, and I think everybody who is practicing it with patients currently has encountered patients who, it's a hard no. Their mind is made up, and some of them are just frankly ready to fight. That's really not what we're talking about. We're really talking about those patients who are interested, they're engaged, but they're concerned, and they have legitimate questions, and they trust you. And so the idea is, if you are armed with good information, reassuring information, and just emphasizing these points about getting back to normal, getting back to be with your families, getting society running again in a more normal function or fashion. Those are the conversations that seem to help. Danny and I were talking earlier this week that younger people in particular, the group under 40, they've heard this internet rumor that fertility is impacted, that basically the women wouldn't be able to have babies, or the men would become sterile. And those are the kinds of things that a trusted physician can really potentially impact. They're not thinking that, vaccines are some terrible conspiracy. They're just worried about safety. And we feel like you guys in Collective could really impact that. So I think that's part of the messaging. It's not so much to pick a fight, leave those people be. Maybe they'll eventually come around, but it's the ones who really just need information.
So along those, Chris just mentioned a couple of these messages. There's many more. There's been a lot of really good work that's done in the communications realm. The de Beaumont Foundation is one entity that has really looked at what messages resonate with different segments of the population, but some that are key across the board is the motivator to return to normalcy, to no longer have to wear masks, to no longer have to quarantine if you're exposed, to no longer have to distance. So this return to normalcy is the biggest consistent thing that motivates people to get vaccinated. And then also the messaging around protecting yourself, protecting your family, which for most of the population seems to be the biggest motivator, and then protecting your community. And that one's a little bit more divided. And then share your story. I mean, physicians have been remarkable examples in this. You'll see here, AMA reported yesterday that 96% of physicians have gotten the COVID vaccine. And so sharing just your personal story, why you chose to do it, your experiencing treating patients, bringing this alive. I mean, so many people have limited proximity to people who have actually been affected by COVID. And so for those of you who are seeing, having your own patients that you've lost or that have been hospitalized, I think really kind of making that personal and real for patients can be really important. And then talking about post-vaccination, what's changed for you all. And then this last note about, using social media, I imagine many of you engage in different ways. There is, and we'll talk more about this in a second, but there is so much misinformation in social media. And so we need voices to counteract that. All right, so the second chunk here, what does it mean to become an actual vaccinating provider, to actually have a vaccine on hand, to have a provider agreement, to be able to provide vaccine to your patients? Many of you have already ventured into that. Some of you have tried at one point, and either because of the CDC process or because of limited vaccine availability or because of kind of the significant pressure to get through inventory quickly, decided not to do that. A lot has changed here. And so I want to just make a few notes about where we are now in the vaccination rollout and why it's much easier to become a vaccinating provider. One, supply is no longer an issue at all. There's plenty of supply. We're not even coming close to ordering down what's available to us. And so there's no issue with being able to access certainly Moderna and Pfizer. We have a lot of Johnson & Johnson in circulation. Johnson & Johnson production in the US has really come to a halt over the last few weeks, really after that that plant, the production plant in Baltimore has not yet received FDA approval. And so we're not sure when the J&J will come back online. Not so relevant for us right now, given the glut of vaccine that we have in terms of supply that's available to us. So no concerns there around supply. Second, the CDC messaging around no missed opportunities. So most of you are aware that the vaccine comes in multi-dose vials, the Pfizer in 6 doses per vial, the Moderna now in 14 doses per vial, and Johnson & Johnson 5 doses per vial. So, we are at prior to this, we needed to have a plan and account for every single one of those doses, always trying to minimize waste. And the goal to minimize waste is an important one, and one that we don't take for granted. We want to steward these resources well. But we also know that the value of getting somebody vaccinated exceeds the risk of not necessarily using every dose in that vial. And so we're really leaning into the no missed opportunity messaging, meaning that if you've got a patient who shows up at 4:30, you engage them in a conversation about vaccination, you should not feel any concern or hesitation about opening a multi-dose vial for one dose. And then one of the big issues along the way has been ordering. So Pfizer, up until recently, was shipping out in trays of 1,170 doses, which was way more than many practices could get through in a given week. And so what we have done now, Pfizer at the production level has started to split up and do 450 dose trays. But our central pharmacy has actually made it possible for practices to order many, many fewer. If they only need 20, 50 doses a week or for a couple of weeks, and so this goes back to the plenty of supply comment, having inventory beyond the week is also no longer an issue. Really, you all can have as much as you can reasonably use up to expiration dates. And so want to encourage that. But what our central pharmacy is doing is taking smaller orders, breaking down those packages, and direct shipping those to providers. And so if that's of interest to you, we can certainly help support that. There is a website here This is what it looks like, the healthcare professional website that really walks through a lot of these different details and provides helpful contact information for each of those things.
Yeah, so Danny, if
Yeah,
I could just jump in here, yeah, I think many of our physicians and medical practices initially, when you think about February, March, they tried to get on board, went through the onboarding process, which took some time, but then they were not able to secure the doses, or the storage and handling requirements were so strict that it almost just, for many people, it just seemed not worth it. And what all of the things we've done over the last couple of months have done has been, first of all, to get many, many more people onboarded. And we're still doing that if you want to be a participant. But we have a lot of people who are onboarded who aren't vaccinating. And so what we are trying to do is spread the news that, number one, it's no longer limited by your local health district. Initially, all the doses that were going to doctors' offices were either going through the local health district, or if you were part of a hospital system, through that centralized mechanism. So now you can actually order those essentially directly through the state pharmacy program, this short or small shipment redistribution program. So that's a big deal. And then the other thing is the refrigeration and handling requirements have really changed. So you can actually keep this stuff refrigerated or frozen for longer periods of time. So all of these things together have just made it a lot easier to be able to have it much more like a flu shot. And I think that's our future state. We want this to be pretty routine. We want it to just be easy for you. And as Danny said, this idea of some acceptable amount of wastage is really what we're pushing. You can order one vial of vaccine. If that's all you want, we'll send you one vial.
Great, thanks, Chris. Okay, so the last segment here, how do we use our voices as clinicians? So, we've talked a lot about the role, the trust that you have with your patients. And you're clearly doing that in those one-on-one interactions with your patients. And some of you have figured out ways to amplify that voice with your patients, either through emails that are going out, through newsletters. And one of the things that we heard from a few clinicians was a desire to do, a kind of webinars with your patient panels. So what we've created is a teletown hall package. An email went out about this around 2 weeks ago, and then a survey went out last week. So hopefully you have seen this in different venues. But the offer is really that VDH staff would do all of the facilitation with the Zoom platform, provide a template PowerPoint in case you need that, provide a one-pager or links of FAQs to help make sure that you have the information you need. And then you would send that link out, invite your patients to it, and ideally have an opportunity for 50, 200, 400 patients to join at the same time, hear from you, be reassured by you, and have the opportunity to interact and ask questions with you. And so we're eager to see if this is something that more and more clinicians need and want access to, and if it really makes a difference to have that connection with not just one patient at a time, but with many patients at a time. So that is a service that we're offering. We're testing it starting next week. But if any of you are interested, please respond to the survey that was sent out to all providers last week, or feel free to get in touch with Chris or I.
And we have a relatively small group this morning, so if you just want to put your name in the chat, I will reach back out to you if you put your email and name in there, because we are looking for the first wave to see if this is effective. So we'd love to work with you.
We are also partnering with a national effort called This Is Our Shot. This emanated out of a consortium of healthcare providers in California and has gotten a lot of traction nationally. Some great resources on the This Is Our Shot website, thisisOurShot.info. And we will be offering webinars, seminars that they give to equip providers on all of the latest information around countering misinformation and what's going on with vaccine, what's going on with variants, all of that. This is our shot is helping to equip providers so that you feel like you have the latest information and can address questions that come up. So be on the lookout for opportunities to engage in webinars that they're providing for providers here in Virginia, or just go to their website and there's a bunch of stuff that you can download there. This is going to be especially important based on, I've mentioned this a few times, the amount of misinformation that's out there. I would say, we hear a lot of different reasons that people don't want to get vaccinated. Many of them are rooted, as Chris mentioned earlier, the fertility example, many of them are rooted in frankly wrong stuff that is circulating in the internet. And I think it goes one step further, because it's not just sort of innocent musings or thoughts by people about what might be going on. It is actually a very intentional effort by the anti-vaccine community to spread this misinformation. Just a headline from the AP last week, 2 weeks ago, that people are paying social media influencers thousands of dollars to spread disinformation about the vaccine. And then there was a national think tank called the Center for Countering Digital Hate that actually did an analysis on Facebook, Instagram, and Twitter. And 65% of the information that was wrong, the disinformation about COVID, 65% of what they found came from 12 specific individuals. And so they tabbed them the disinformation dozen. There's a whole report written about this. But the concept that I'm trying to share is that this is a very strategic and intentional decision to get bad information out there. And we, as a clinical community who trusts and believes in science, have to counteract this. And it's gone a step further than just people spreading bad information. There are actually now bots, programs that have been created to actually spread these COVID untruths. So it's kind of remarkable, but I hope what you all are taking away is that your voice is needed more than ever to counteract what's going on out there. Again, from the Kaiser Family Foundation COVID Monitor, just the top 5 things that they're seeing, the top 5 myths that you can get COVID from the vaccine, that they cause infertility, that they contain aborted fetal cells, that you don't need the vaccine if you've already had COVID. And obviously, we know that having contracted COVID gives you some degree of natural immunity. But what has consistently been shown is that vaccine-mediated immunity provides a much stronger, much more robust immune response, and that we don't really have a good sense of how long that natural immunity lasts. And then the last one here, COVID-19 vaccines can change your DNA. And so what KFF did, they basically just said, of people who are unvaccinated, how many of them believe that these are true? And you'll see that, about a third across the board believes that one of these is a reason, and that's the reason they're not getting vaccinated. So here's just a sampling of the things that are available to you all as providers. So the teletown hall I mentioned, there's resources on the VDH website specifically geared for healthcare providers. There's a toolkit on the CDC, and AMA, AFP, a bunch of other organizations have kind of done Q&As, FAQs for physicians. And then the This Is Our Shot campaign is all linked right there. And then the federal government has done a lot of really helpful things as well. This was a virtual town hall they did this past Friday with members of the COVID-19 response team. Here's the link to it. It's about an hour and a half, but really aimed at primary care providers, and really helpful. Some really great examples being shared from around the country of how different providers are engaging their patients. All right, I will kind of in the final thoughts here on where are we seeing gaps, and Chris, feel free to chime in on some of this. There's a few key demographics that we're leaning into. This is a snapshot of where we are in terms of our overall vaccination numbers. the Black and Latino have been big areas of focus because that's who was carrying the greatest burden of COVID cases, hospitalizations, and deaths. We've done a fairly good job in Virginia of getting to the Latinx community. We're about 13% of our vaccinations are going towards the Latino community, whereas our baseline, we're about 9% Latino as a state. We have not fared as well in the African American community. Virginia is 19.5% Black, and we have gotten to 14, not quite 15% here. So a lot more work. I mean, despite a lot of effort to partner with faith communities to get mobile and community vaccination in predominantly minority communities, but there's still work to do here. A few examples of the kinds of things we've done. Again, partnering with faith communities, doing on-site vaccination in churches, having churches participate by, when we were holding mass vaccination centers, saying, hey, this network, you've got 200 slots on Friday, bring folks from your congregation, and partnering across faith demographics. Here's an example of where Centera actually did after-hour vaccinations during Ramadan with the Muslim community. Addressing transportation barriers. So we have had some local solutions here, but then the federal government has also contracted with Uber and Lyft so that you can text the number and text your zip code, and they will set you up with an Uber or Lyft driver to take you to a vaccination opportunity for free. And then mobile units. So a lot of our local health departments have mobile vans, and then our partners, here's Virginia State University's mobile van. There's a few other examples around the state of where we've really relied on, if not a mobile vehicle, then at least just a small team of nurses going out into a community and doing pop-up vaccinations. We've also really leaned into the communications to these specific demographics. We actually hired a Black-owned communications firm called Green Street Communications to develop a lot of materials that really reflect the patient populations we're trying to get to. All of this is available on our communications hub. And if you guys want shareables, we can certainly get those to you. Just a few quick examples here: celebrating Diversity Month, aligning our vaccination efforts with our equity mandate, a specific campaign for barbershops and beauty salons, and then a Mythbusters campaign. And so these are constantly being generated for different audiences and then hosted to the VDH Communications Hub. And then a couple last thoughts on other demographics. Rural communities, as Chris mentioned, we're seeing big disparities in vaccine uptake between urban, suburban, and rural communities. And so we're seeing much more of the definitely not people living in those rural communities. They really buy into a lot of the conspiracy theories, or they dispute the seriousness of this disease. And that aligns a lot with their kind of consistent beliefs about vaccination. And then Chris has also mentioned the younger demographics. So this first graph on the left here is the percentage by age range. And so you see we've north of 85% of our 65 and ups with at least one dose. And there's just a very linear relationship with age. And so when you get to this millennial and Gen Z population, you see that we're hanging around 47%, something like that. It's probably a little bit better now, but there's a lot of opportunity there because, as I said earlier, these are not necessarily people who are saying, I don't want to get vaccinated. It's just that it hasn't been a priority. And so by decreasing barriers to access, by helping them understand the value proposition for protecting yourself and protecting your family and protecting your community, we think there's a lot of opportunity there. And that just kind of the point I just made about there's a lot of folks who are in this whatever I get around to it. So some work to do, but also a lot of opportunity there. We don't need to do it in this venue. Would love to follow up in individuals and small groups, but there are a number of things that would be really helpful for us to know from you all. And we because it is a smaller group this morning, we could actually talk through some of it, but wanting to hear, like, what are the concerns that you're hearing from your patients? What are the challenges to actually get vaccine into your own practice? And then what data do you all need? And is there any other way that we can support you all? So Chris, any other closing thoughts? And then we'll open it up to questions.
Yeah, I think, with this group, we are just all trying to emphasize that we know that the younger people don't necessarily come to their primary care physician or specialist that frequently, but we're just trying to get to a point where the conversation is sort of built in. Maybe it's the person who's checking them in for the visit, or staff who's rooming the patient, or yourselves, just so that you're kind of just doing the due diligence and just addressing the issue. And then if there are, honest questions that they can be answered. And like we said before, not necessarily targeting the hard line no's, but a lot of the people are convenience users. And so, if they're in an environment where either you guys can administer the vaccine yourselves or easily refer them to a local pharmacy or other outlet, that's sort of what we're shooting for here. So in terms of questions, please let us know what we can do better, because we're constantly adjusting the operation, and we can do some troubleshooting even at the individual office or clinic level.
There is one good question in the Q&A. Someone says, I have found that many of my patients who refuse vaccinations are more conservative. Are there any good websites that I can direct these patients to from more conservative Fox News-like approaches which encourage vaccines?
Yeah, that's an excellent observation. We actually do have a specific survey of 1,000 conservative voters. Now, it wasn't just Virginia, but it was across different parts of the country. And you do see very hesitant portions of the population in that group, if you want to call them voter groups, whatever. So interestingly, it's not scientific data that the people are going to respond to. We look at what is going to be the most influential. Is it going to be, politicians? Is it going to be, your commentators, your Sean Hannity's and so forth? They actually ask these questions and rank them. And the number one and number two influencers in the conservative group were their doctor and their spouse. Number three was Donald Trump. Okay, I'm not saying that in any positive or negative way, but beyond that, it was just a huge drop off. Nobody else really had any influence, particularly scientists.
And for many of those conservatives, their pastor or their faith leader.
Mm-hmm. Right.
I would add to those, yeah.
So I'll take that one back. I'll look and see if there's, the Wall Street Journal side of the conservative house is a little bit more analytical, and I'll look through there and see if we can find something that's a little more palatable, maybe to some people, and we'll be happy to share that.
So maybe a couple of additions to that. I'm not sure of a place that you could direct patients to that address. So I mean, there's a lot of as we talked about earlier, a lot of toolkits, FAQs by the CDC, by VDH. I'm not sure that that's going to solve the problem that you're stating there. There are places, so I would point back to the de Beaumont Foundation for you as a provider, because I do think Tom Frieden, former CDC director, and Frank Luntz, who is a well-known Republican kind of political operator, did a bunch of focus groups with rural Americans, with conservative Americans, and just hearing the language and looking at the points that were brought out about the kind of language and the kind of messages that do work, I think would be really helpful to you if that represents a bunch of your patient population. And then for specifically the Christian community, I think Richard made a great point that working with faith communities, that pastors in particular have a really important voice here. It's one of the reasons that we've started to engage pastors, figure out What is the role and willingness of pastors to bring this up with their congregations and support vaccination, either through communication, through on-site vaccination efforts, through encouragement, et cetera. But there's also a website called christiansandthevaccine.org. I think Curtis Cheng is the guy who started that, but he has a lot of well-known Christian leaders who come in and sound off on different questions that may be of concern. So a couple of quick thoughts there. I also see a couple questions here from C. Can definitely make the slides available. I'll download those and send those to Taylor to distribute. And the next question, we need to provide the best available info on risks, and how is VDH supporting that? Well, I'll point again to what will be upcoming in the next few weeks are opportunities from This Is Our Shot. There's a couple of other entities out there, and then that White House town hall all do a good job of laying out what the risks of COVID are and how we as providers, as clinicians, should be addressing them with our patient population. And so when you all get the slide set, you can follow through some of those links.
Okay, well, Dr. Avula and Dr. Gayamagamai, thank you so much. I think that you have really given us a lot of information here to think about where we've been, where we are, where we need to go, and what physicians can do. As you said, patients often will trust their physician more than social media or other sources. So if physicians make vaccination another vital sign and ask early and often, maybe we can move the needle and get that unvaccinated people vaccinated. So I think that's great. And that question anticipated something that I was going to say. As with all of our webinars, the information from this webinar will be posted on the MSV website after Dr. Avula gets it to us. And it's being recorded, so it will be posted. So if you have found it useful, or if you want to go back and look at something in more detail, or if you know other people who would benefit from this that weren't able to join us this morning, please refer them to the MSV website, where they will be able to access this information. So we're a little ahead of schedule, but maybe there are some more questions coming in.
One from Grace
go ahead.
Connolly on the myocarditis. So, this one is unfortunate that, it's just the latest kind of thing that we're learning about. They're still doing a lot of analysis on this. It is not entirely clear whether or not the rate of myocarditis that is seen after people have been vaccinated is actually greater than the baseline rate of myocarditis just in the population. So that analysis is still being done. These are mostly subclinical, which is what makes it very difficult, because ordinarily we don't look for subclinical myocarditis. And so I think that it is an open question. Right now, the CDC and the FDA have not changed the guidance in terms of who should be vaccinated, but we are keeping a real close eye on particularly the group of younger men. So whether that's 18 to 25, 18 to 30, but that is not clear. But in terms of the risk of adverse clinical outcomes related to this, it's a hard conversation to have, but they do seem to be mild and self-limited diseases that really don't seem to have a lot of clinical consequence at this point. So I think that information is going to improve probably in the next 1 to 2 weeks.
Yeah, we probably will know a little bit more. The Advisory Committee on Immunization Practice is meeting on June 18th to review the data. So probably sometime next week, we'll have a clear idea of, is there actually an elevated rate from baseline on this?
Yeah.
One other question oh, go ahead.
I'm sorry. In my academic work, I did a lot of work with cardiac markers in the past. And this reminds me an awful lot about what do you do with these low-level troponin measurements that you'd find in different hospital or ER settings. And it's the same kind of thing. It's like, well, maybe it's a risk predictor, but clinically, it probably doesn't really change what we do. And so my sense is we probably are going to acknowledge, but not overreact.
One other question that occurs to me, it was a great advance when the vaccine became available to ages 12 and up. And it was good to see a lot of the middle school and high school students coming in with their parents to get vaccinated. I've had some questions about when will vaccines be available for children under 12. And I know there's, of course, a lot of research going on with that. And then related to that, because of this issue of myocarditis, the concern of parents getting younger children vaccinated. Where do we stand on that? How far off do you think that is?
So, the child trials are ongoing. The reason that they've taken a longer amount of time is because they are having to test different dose strengths. And so, the 12 to 15 are using the same dose as adults, but each category of age below that will be using a smaller dose. And so we anticipate probably by October that we should get an approval for at least the 5 and up. And both Moderna and Pfizer are starting to close up those clinical trials. And I think they've actually already submitted that data for review. I'll need to double check that. But, what we're hearing for younger ages is October-ish, and then probably later into the year for kids down to 6 months.
So in the meantime, those age kids will need to wear masks, I guess, in school.
Yeah, that's right. I don't see that guidance changing for schools in the fall.
Okay, well, once again, thank you very, very much for a very informative webinar and for taking the time to be with us today. And thank you to all of you who joined us. Please go out and share the message and encourage others to view the webinar if you think it will be helpful to them. So
thank you, Richard.
Thank you.
Thank you, Melina. Thank you, the whole MSV team. Appreciate you guys.
Thanks
Take
for
care.
having us.
Thanks a lot.